Welcome back to another segment of Top 10 Questions.
Hi, I'm very excited about today's segment. We'll be talking about frequent colds, snoring, and allergies in children. So let's jump into the first question. How common is allergy in children?
So, guys, allergies in children is very, very common. Okay. The fundamental reason for that is because allergies is nothing but your immune system which is learning how to manage different kind of irritants. So for example, when you're breathing in dust, the immune system is learning, okay, this is dust, this is not harmful, this is a pollen, this is not harmful. This entire process is going on in children's bodies. So children have something called as transient allergies. That means for 6 months they can suddenly become very sensitive to certain kind of pollens, but 1 year later that may completely go away, and again 2 years later they may get allergic to something else. So allergies in children is one of the most common issues that we see. But here is the but, and that is that all sneezing, all colds, all issues in children is not allergies, which is where I see the fundamental problem that parents face. That is that their children might be sick, they might be having significant other issues, but more times than not when we meet them in our clinic, they have spent 6 months, 8 months, 12 months roaming around, going to different doctors, and everybody has been telling them that their child just has nasal allergies. So yes, allergies are very frequent. Yes, they are the commonest reasons of sneezing, runny nose, etc. in children, but it is not the only thing that can happen. And our job is to identify which kids have allergies and who are the other kids who are being misdiagnosed as having allergies and being forced into a childhood of suffering where they cannot go out in the rain, cannot play in the water, cannot have an ice cream, keep falling sick, can't go on trips to the mountains, stuff like that, who can be helped by understanding the problem that they're facing and treating that problem.
So like my child catches cold frequently, so like of snores, like how do I know it's allergic or not?
Okay, so I think the question that we're referring to is if your child is catching cold or is snoring, how do you know that it is not allergies? Or in other words, when do you need to be suspicious? Now remember this, we do want our children to fall sick 2 to 3 times in a year. That is helpful, because that is something that teaches our immunities how to fight infections. So catching cold is not by itself a problem, but if your child is catching more than 6, 7, 8 episodes of colds in a period of 6 to 12 months, then that is a problem. Why is that a problem? Because that means that their immune system is being hammered by different infections so frequently that their bodies are not getting the time to recover from the infection and learn and become stronger. It's the same logic. If you have soldiers, you do want them to get some active training so that they know how to fight actual issues and actual criminals or terrorists. But if you're at an all-out war, like is happening in certain parts of the world now, you run out of soldiers. So you start sending older people, young kids to war, and they're not ready to fight the enemy. They have not had the training. So do you think the defense of that country is getting better or is it getting worse? And it's a very similar thing that happens to children. So colds, yes, if it is getting beyond 6 to 8 episodes in a matter of 6 to 12 months, that is a problem. If your child is snoring when they catch a cold or when they're very tired, nothing to worry, it's completely normal. But if your child is snoring every night, even when they do not have a cold, they're snoring for more than 50% of the time when they're sleeping, or their snoring sounds like an adult person, which is a key phrase that we talk about, then that is absolutely something you need to take seriously. Remember, adult males can snore because the tissues in our adult males is bigger and harder, but children have very soft, very delicate tissues. So in normal situation, they will never ever snore. If your child is snoring every night, there is only one reason behind it, and that is that their breathing passage is obstructed more than 75%, which is causing them to snore. So if these two issues are there, according to international guidelines, including the ASPO guidelines, these are things that you need to take up seriously.
So what are the long-term implications of adenoid hypertrophy and sinusitis in children?
Right. So, if your child does not have allergies, the most common issue that happens in these children is that a tissue grows behind the nose called adenoids. Now, these adenoids are basically very similar to tonsils, except that they don't sit in the mouth, they sit behind the nose. All children have them. But for some children, the adenoids become very large, either because some bacteria is hiding inside it, or because of multiple infections, the adenoids themselves have become so swollen and inflamed that they are blocking the mucus passage and the mucus clearance from the nose. So as this keeps on happening, they keep on catching colds. Many of these children start having blockages in the sinus openings or scarring in the sinus openings. This is one issue which is very frequently missed out by doctors and parents alike. And it is found that if these issues are not treated, the fundamental problems that happen will affect your child throughout their life. The first thing is sleeping. So if your child is not sleeping comfortably and they're snoring, that means they're not getting enough oxygen when they're sleeping. Now remember, your brain or my brain may be able to tolerate 10% reduced oxygen, but your child's brain is like a computer. It is growing massively. And if every night it's not getting enough oxygen, it's the same as having a plant that you're not giving water to. The plant will never grow to its full bloom, and that's exactly what happens to these children. In our childhood, we could remember some kids who were good when they were young, but as they grew up to class 8th or 9th or something like that, they have stopped studying, they have become backbenchers, they've started becoming destructive, and we used to call these kids shararati or naughty or badmash bachche and stuff like that. We find out now that many of these children, the issue was undiagnosed sleep apnea and snoring, which made their brains not mature correctly. So when the studies evolve to class 8th or 9th or higher studies, they just can't keep up with it. So long-term implications, number one, these children may not achieve what they're meant to achieve, and it may ruin their lives. Other things that can happen is very frequently they have major sinus issues in later life. They have major immunity issues because their immune system is not able to mature. They very frequently also have dental caries because their teeth don't get to develop, so they have dental issues, jaw issues throughout their life. So there are multiple issues like this that happen to children, and that is one of the fundamental reasons why this talk is very important, because we need to identify the children who are not just allergies, and we need to treat them, because if we don't, if we leave them, the children will carry those problems throughout their life with them.
So how can we treat these issues?
So the treatment of the issues starts with diagnosis. The first thing is we have to identify if this is allergies or not, and the best way to identify that is by getting a CT scan. Now many times I get people who have come to my clinic with an X-ray. An X-ray is useless for me. I am a rhinologist. I can't remember how many times I've done X-rays in the last 10 years for adenoid hypertrophy, because I can see the adenoid hypertrophy even with a scope. So the X-ray does not give me information. A CT scan instead gives us the same level of radiation exposure, but it gives me a very critical information. That is, does this child only have adenoids, or does he also have scarring in the sinuses? If I don't do the CT scan, I can never know. If the child does not have sinus issues, then I can guarantee that if we go ahead and fix the adenoid, this child will go back to completely normal. But if this child has sinus issues at the same time, then we also need to open the sinuses. It's a very minimal thing. It is not a sinus surgery, because remember, the time period that the disease has been there is very short. So at max, it is the openings which are scarred out. So as long as we open the scarred areas, the sinuses will revert back to normal. But if this is not treated, over the next 10-15 years, they will develop into chronic sinusitis where the entire sinus linings have been damaged, at which point we may need to do much bigger surgeries. So while many of these children will fail allergy medicines, nose sprays, and may need a small surgery to fix it, the surgery is very safe, very sure, and it allows us to give great results over a long term.
So what are the surgical options and who needs it?
So if you think about it, like we talked about, if your child is falling into these categories, as a mother or a father, you are the one person who's always going to know. If you're getting a gut feeling listening to this talk, thinking, oh my God, this sounds like my child, you're probably right, because I very rarely see parents being wrong about their kid. So the next step becomes to come into the doctor and for us to evaluate. Once we have evaluated, if there is even a 10% chance that we can use medicines or sprays or treatment like that to keep your child healthy and out of the operating room, then we will give it a shot always. If your child is failing, then we need to go ahead and explore surgical options. Now these surgeries are done without any cuts and they are completely painless surgeries. The surgeries are done on one day and your child can go home the next day pretty much normally. There is nothing inside the nose that we put, and your child can go back to playing, eating, everything normally, because the adenoid surgeries are painless. If your child has a sinus issue, at the same time we can open the sinuses, and that does not increase risks, that does not increase pain, that does not increase healing time. Your child can still go home the next day, still start doing everything normally. I need to see them back once at 1 week, and that's pretty much it. Some children will also have tonsil growth along with these, and for those children we do recommend 1 week of rest, because with all our techniques, the muscles that house the tonsil, they do try to go into spasm, even though it's less than 80% with current techniques, but still children do get a little sore throat. So we do recommend giving your child a few days of rest. By about 1 week, they usually will bounce back and they'll be ready to start their new childhood and going to school.
Okay, so what are the risks, complication or healing periods?
So as surgeries, these are very, very safe surgeries. To be honest with you, one of the main issues that we would hear about this is that adenoid surgeries will fail or adenoids will come back. And that is the wrongest possible thing that I've heard in my life. It's like saying if I cut off your finger will come back. Adenoids are not tumor. They are not any kind of tumor. They're natural normal tissues. If the adenoids have been removed properly, they can never ever come back. The reason why adenoids used to come back in the past was because in the past we used to do this surgery blindly, and the adenoids are actually like a C. They're sitting behind the nose like a C. So blindly, as doctors, we'd remove the middle part of the C. Now if you have left the sides of the C, over some time these guys would grow back to the center, which is why in today's techniques we use an endoscope and a tool called a coblator to make sure that we have removed every inch of the adenoid tissue. Once the adenoid tissue is completely removed, the chance of failure in adenoids goes down to 0. It is the same thing with nasal sinus surgeries, because in these sinus surgeries, most of these sinus issues start from the adenoids. So if we have taken care of the adenoids and we have diagnosed and treated the sinus at the same time, chances of failure is very, very less. The only situations where it might fail is if the child has a genetic problem where they're more likely to get nasal polyps, but that is very, very rare. The other thing is that even before you do these surgeries, you have to tell the parents that the surgery is to improve the colds, falling sick, snoring and sleeping. Does not mean that the child cannot develop a transient allergy to something and some sneezing, nose block 1 year later. If that happens, you may need to give the child some support with nasal sprays for a couple of months, but that does not mean the surgery has failed. It is just a natural part of growing. So it's not that the allergies are being treated by surgery. We are treating the other causes which will predispose or worsen the allergies in children.
So what is the success rate and long-term results like?
So as we have discussed about this many times before, once we do these surgeries, it is very, very unusual for us to see parents who come back after the healing period and say, doc, we don't see results of the surgery. Because these surgeries are some of the most successful surgeries that we do. Overall success rates are above 97-98% across centers. So surgeries are very, very successful, and long-term wise, it really depends. Again, children can get transient allergies at any time, but long-term results regarding these particular issues that they were dealing with, the snoring, etc., are very, very good across multi-center studies across the world.
So can the problem come back after the surgery?
I think we already discussed that, and the answer to that is adenoids can never come back. Sinuses should not come back in most cases, like 99% of cases. It is not possible for any doctor to give you a guarantee that the sinus problem will not come back, but the chance of that happening is very, 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 very less. From personal data, I think in the last year or so, we have had one child who came back to us with nasal polyps, and we have done more than 300 of these surgeries. So I would say that the chances of this coming back is very low in a long-term situation.
A very common question is it a laser surgery?
Again, laser is just a tool. So laser is not any kind of magic, and you would be surprised at the number of times I hear this. No, this is not a laser surgery, because laser creates more heat than all other techniques. This surgery is being done at an area which is very sensitive. So behind that is your spine. So we don't want any heat, we don't want any burning, we don't want any cutting. So these surgeries are done by using a tool called coblator, which actually removes the tissue by using something called plasma. That means that the tissue is melted away without pulling it, cutting it, tearing it, or burning it. And that is what has made these surgeries so easy for children to get, so safe for children to get, and so easy for us to offer as to parents, because in this technique because there is no burning or cutting or pulling, there is very, very low chance of bleeding, there is very, very low chance of pain, and recovery is much, much faster with these modern techniques. So laser can be used in different surgeries, but in this surgery, laser is not at all an optimal tool to be used.
So are there any long-term implications for my child if the surgery is not done?
Yes. If your child is having allergies and it is improving with medicines, and if they're doing well on medicines, then you do not need to do a surgery for the kid. But if your child is suffering, and what I tell people is that if you come into my clinic, and even if your child is having snoring and all of these, if you have not tried medicines and the sprays, we will still give your child at least a 30 days trial of medicines. Because if we can keep your child out of the operating room with the medicine and they're doing well, then that means that your child will not have long-term issues. But the reason why many of these children go on to develop, intelligence issues or sinusitis issues or immunity issues is because many of the children who are diagnosed as allergies and are just told this just happens in kids, or this is something that happens to every kid, or this is just the weather here, that kind of stuff, these are very, very blanket and vague statements. And under the guise of this is the weather, a lot of kids have this, it's just kids, there is a group of children who are being missed out, who could be helped by proper diagnosis, proper treatment and required surgery, and those children do absolutely have long-term implications, and that is what timely diagnosis and treatment can prevent.
That was our 10 questions.
Okay, so those were great questions, and again, just like Dr. Harini said, it is a very, very important topic which is very close to my heart as well, because there is a large number of children who suffer under the misdiagnosis of allergy. So I hope this helps clear this up. This is an important topic. If you feel that a child is suffering, please make sure they see an ENT doctor nearby so that they can be at least diagnosed if they're suffering from these issues and be treated. Thank you for joining us. We'll be back soon with another episode, Top 10 Questions. We are DrBhattacharyya ENT. I'm Dr. Diptarka Bhattacharya, Dr. Harini and Chris Adney. Namaskar.